Hello, this is Dr. Scott MacLean, and this is a YouTube video about implant dentistry. Today's patient has lost her anterior bridge, so it was decided to place some dental implants to restore back the function and the aesthetics in this area. So 3 implants were placed about 3 months ago. We have the patient back today, and we've already done an impression, and we're now about to take a bite registration. So the impression was taken with some impression copings for open tray. We used some stabilizing wire to enable us to get a good accurate impression. Now the same day we're also going to take a bite registration. So we go to the healing abutments and we're going to remove those. We'll be using some temporary cylinders, and this is on the Nobel Active implant. So you usually have to cut about 2 of the rings off to make it so that it's going to fit properly into the occlusion. But here we are cutting it back so that it'll fit on the implant and provide us with some space, because we don't want this to hit into the bite as the patient closes together. So we'll screw this onto the implant and then check our space. So it does have a non-engaging interface, so it doesn't have a hex on the end of it. It kind of just sits on top of the implant. So this is enabling us to pick up the bite, and we'll be attaching these together with some stabilizing wire. So here we show the patient closing. And it's important that the patient does not touch the cylinder in this position, because we don't want to disrupt the bite when we're taking the bite registration. Once we have the first cylinder in place, then we start to place the second and the third. We're going to attach these together and then take a bite registration. The reason we do this to have an accurate mounted bite in vertical dimension of occlusion and allow it to not be rocking when the patient bites together. Because if you hand articulated this case, taking the models and kind of putting them together, you'd have a problem, because you wouldn't be able to find out where the canine teeth are going to be situated on the other arch. The difficulty in these cases comes from getting the bite registration, because once we have that, then we'll know where the teeth are going to be sitting on the implants relative to the lower arch. And this is critical, because the establishment of canine guidance in this case depends on a proper record and vertical dimension of occlusion, and this is critical to make this case function properly. So here you can see the cylinders are nice and open. We're going to be able to put some bite registration material between them and not have the lower teeth touching. In many of these cases we have to cut down some of the lower anterior height in order to make the occlusion proper, because they've super erupted over the years due to the bridge work or due to the partial that they're wearing. So in this particular case, we did cut down some of the lower anteriors. Here we're using some stabilizing wire from Keystone Industries, and you can pick this up from keystoneindustries.com and cut it into small pieces and use it with some resin to tie the cylinders together. And you can also use this material to tie the impression copings together. It's a great way to stabilize the different pieces that are going to be sitting on top of the implant. Once they're tied together, then we're going to take an x-ray to make sure it's sitting down on top of the implant, because the bite registration is going to be all kind of subsequent to having this seated properly on the implants. I'll then take some flowable resin and just cover the wire, because we're going to be using some clear resin to pick up the bite, because I want to see the cuss tips. So I'll use this flowable resin just to kind of pick it up and give it some security. It help to make it so that when it comes off of the implants as a piece, it stays as one solid unit. And this is, a bite table. That's what we're calling it, a bite table for picking up an implant occlusion. The neat thing we can do is to take a little tip and put it on the end of the triad container, and this allows you to be very specific where you're going to place the triad gel. The triad gel is a clear, colorless type of product from Dentsply, and it allows you to start to pick up the occlusion, because we want to see where the cuss tips are hitting in the resin. It's important for us to know that the patient is actually staying in the correct vertical dimension of occlusion. It's important to put this resin not in the access holes, because we want to be able to get these off after we pick up the bite registration. So you can put it between the access holes and just apply only a little bit just to get the cuss tips, because you don't want to have it locking down on the lower teeth as well. So just pick up the incisal edges only. Then we're going to check the vertical and make sure that the vertical is properly situated. You can see here in the premolar area the vertical is accurate. So we want to pick this up so that it's going to be representative of what's actually in the mouth. I like to keep adding it so I can pick up as many contacts as possible in the anterior, and this enables us to have a real accurate bite. So we can just kind of keep picking it up and putting only a little bit in, because you just don't want to get too much of this. And when you start to get a little bit too much, you're going to have to cut it back with the diamond drill. We'll do that in a second here. But then do the Lightcure and keep doing a little bit at a time. But the beauty is the clear liquid allows you to see exactly what's going on. So once the Lightcure has occurred, then we take a diamond drill and cut some of it back so it doesn't impede her closure movements. And this is important because it can actually hold her up during the bite registration. We don't want to do that. I like to keep checking the posterior bite to make sure it's closing properly on my contact points. You can check both sides, but kind of keep an eye on one side in particular, because it allows you to make sure that the vertical is not opening, and that would be a problem in these particular cases. You can take a little Explorer just to tuck a little bit extra resin in there, then keep light curing it, and we're just about done. The key to getting this bite registration accurate is to make sure it doesn't kind of hold the patient up too much during the bite registration. So you have to visually see that it's going to be seated down. So we just cut it back a little bit more with a diamond, and then we're going to make sure that it's seated down properly as shown here. So we'll take some bite registration material that's soft, put that in the posterior only, and then when we have the patient bite together, we'll be able to see that the anterior is seated. Now we're going to get to the patient to bite a little bit more. And so once the patient bites into that, then we're going to be able to make sure that we have a really accurate bite for mounting on the articulator. We're going to use a Denar articulator in this case, so we'll put some baseplate wax on the bite fork and put a double layer of the baseplate wax on the top and just a single layer on the bottom. And then we'll have the bite table actually still in place, so it's going to provide a tripod type of effect, because normally only the posterior teeth would have been on this bite fork. So by having the anterior jig, we can get a stable bite fork and have it very precise for mounting on the Denar articulator. So we'll take this and put it in position, kind of keep around Frankfurt plane, and this is going to provide us with a good solution to establish canine guidance again on this case. And one of the reasons I like the Denar articulator is because you can now take it apart and then lift up this part, keep the other part, and send it to the lab. And so you don't have to send the whole Facebow to the lab, because the lab really only needs the anterior jig to mount the case in the proper maxillary position. So you can see here the tripod effect that happens once you're doing it with the anterior bite table. I like to use the torque control wrench to unscrew these parts and pieces now. It's a nice efficient way to get in there and get the screws out. And there's also on the end of it a torque control lever so that you can put it on different settings. So for instance, you could put it on 15 Newton centimeters and be able to tighten it to that level. So here we're using it to take them off, so it makes a fast and efficient way to do that and get the bridge work out, because sometimes it's hard to get the little screws to pull out because you still have one engaged in another spot. But here's the bite registration table, and we're going to take this to the lab. The lab is actually going to pour up the model with replicas, and then we'll be able to use this jig to mount the proper vertical dimension of occlusion. So we'll put this back on the model, then mount the maxillary bite fork and get it on the Denar articulator. And then we're able to then take the lower model and use the bite registration that we had with the Blue Moose to put the case together. We use the torque control to now put the healing abutments back on. Important step to not to forget, so that these areas don't collapse in, because this is a deeper tissue area, and so we want to make sure we get these back on fairly quickly. We can put the denture back in place, and this will provide her with the aesthetics. She's looking forward to getting her new bridge so she can get rid of this. So our goal is accomplished. We end up getting a bite registration, a verification jig, and getting our Facebow mounted, and getting everything ready for the implant case, which is fantastic. So this is Dr. Scott MacLean, and this has been a YouTube video about implant dentistry.